West Nile virus infections are surging at a rate that's raising alarm bells. Case numbers are about 40% higher than what health officials typically see at this point in the year. Is this just an unusual spike, or a sign of something bigger? The Centers for Disease Control and Prevention recently released data showing over 770 confirmed cases as of early September, with roughly 490 classified as severe. To give context, this time last year saw about 550 cases and only around 350 were considered severe. That's a jump no one expected. Here's the part that surprises most people. Health warnings are intensifying because August and September are usually the peak periods for West Nile virus activity, thanks to mosquitoes thriving during late summer. Dr. Robbie Goldstein, Massachusetts Public Health Commissioner, echoed this urgency in a recent statement, emphasizing that the threat from infected mosquitoes remains high throughout the region. So, what can you do to protect yourself? Experts suggest wearing long sleeves and pants way outside and always opting for an EPA-approved insect repellent. Even small measures like staying indoors during dusk and dawn can make a difference, since that's when mosquitoes are most active. For those wondering how West Nile virus became a headline in America, here's a quick history lesson. The virus first appeared in New York in 1999. It didn't take long to spread across the country, hitting its peak in 2003 with nearly 10,000 reported cases nationwide. But here's where it gets controversial. Scientists believe many infections go unnoticed every year. Tens of thousands may contract the virus but experience little more than mild flu-like symptoms, such as general aches, headaches, or skin rashes. Most people aren't even aware they've been infected. And this is the part most people miss. Severe cases can be truly devastating, triggering dangerous inflammation of the brain and spinal cord, or even leading to death. Over the past decade, about 2,000 cases are reported annually, on average, including 1,200 neurological emergencies and approximately 120 deaths each year. This year, CDC officials warn fatalities could climb higher, but they caution that it's too soon for exact numbers. The underlying issue isn't a huge uptick in mosquito populations. It's that a larger percentage of them are carrying West Nile virus. Environmental factors, such as higher temperatures, increased rainfall, the pattern of local bird infections, and how actively communities are spraying for bugs, all play a part in this trend. Colorado stands out as a hotspot, accounting for about 150 of this year's cases, far more than most other states. Take Fort Collins, for example. Last month, researchers found an astonishing rate of infection among local mosquitoes. 35 out of every 1,000 females were virus carriers, compared to the usual 8 out of 1,000 for this time of year. Roxanne Connolly, a CDC entomologist, points out that the unusually moist and warm weather could be a factor, but the reasons aren't entirely clear. But here's a question for you. With infections rising and climate patterns shifting, do you think local governments should increase mosquito control, or is it up to individuals to take precautions? Which side of the fence are you on? Ready to share your thoughts? Dive into the comments section and let us know whether you're alarmed, skeptical, or somewhere in between. Could there be an overlooked angle to this story?